how can we know that you are how can you know that you are an AIDS patient? So to know this, there are some of the symptoms that will show to you. All right. So once you are being infected by the AIDS, then your uh, you'll be started that a person feel fatigue or tired, suffer from loss of weight and fever, and sweat profusely. No, so see, after you are being infected with this HIV, then you will be you will be started getting suddenly getting tired. No, your body will be very tired and started losing weight and even fever, and you'll be getting sweating. No, sweating profusely means non-stop. No, non-stop sweating started will be started. All right. Then it also will be showing that you'll be having a dry cough. No, you'll be started getting dry cough, or your oral rash. No, like when you're trying to speak something, you happen to start it very fast, but you could not able to speak out clearly. Your voice become, you feel like you're speaking very fast like that. No, so and moreover you'll be having the your shortness in breath. No, your breathing will become shorter and shorter. All right. Not only that, you'll be getting even headache, your visual disturbances will be happening, you will not be able to see properly, and even you'll start getting vomiting like that. All right. And moreover, your intestine, you'll be getting a gastrointestinal problems. No, so frequently you'll be getting like diarrhea. No, diarrhea will be occurring to you frequently. All right. And your skin also started getting infected. No, fungal infections like that. No, so all these things started to show in your body. And not only that, uh, a type of lung disease known as pneumocystic carni, okay, pneumonia develops. So this is one of kind of disease of our lungs. No, so these things also will be started. And cancer or tumor of blood vessels known as uh, Kaposi's sarcoma may be seen. See, even the our blood, since as this HIV enters to our blood, so it started killing the cells of our blood. Okay, so when our cells are being our blood cells have been completely destroyed, so we started getting like cancer. No, cancer starts, or tumor of bloods. No, so these things will be showing. Okay. Nervous system may be affected, so our nervous system, so that goes to the brain. No, so all these things started getting damages, so damage will be started, and you will start getting loss of memory, ability to speak and to think. No, slowly you will not even able to speak, you will not even able to think. All these things will be happen to you. So a complete infected AIDS patient may die within 3 years of infection. So once you get infected, so slowly within, if you're badly, if you're completely started getting infected on this by this AIDS, so hardly you will be able to survive for 3 years. So within 3 years, before 3 years you may also die, but maximum time that you can survive is you can only survive for uh, 3 years. All right. So now, how can we control? So, how can we control this disease? Or how can we prevent from this disease? So, to prevent or to control this disease, we have to follow some of the things. So, number one is responsible sexual behavior. So, responsible sexual behavior. So, in this, what is the main important thing that you have to do is avoid multiple sex partners. So, you must not have a sexual intercourse with, different people. Right. So if you have a sexual relation with more than one person, so it can be a lot of chances, like when you go out and having those kind of taking these things as a pleasure, no. So it has a high chances that you get this disease. All right. So use condom or other barrier methods of contraception which prevents direct contact between body fluids of two persons. So you whenever when the only things that we can at least prevent somehow is like using condoms. All right. And not only that, avoid prostitution and homosexuality. So avoiding we must never in order to satisfy our things, we many we used to know that there is a prostitution like that, these things, no. So we must never go to all those kind of places. So these kind of places are most most risk in getting this kind of disease. Okay, AIDS. Okay, next one is screening of blood before transfusion. So as I told you, as I already explained to you before also, screening of blood before transfusion. So we have to always properly screen the blood properly before we go for transfusion. So we must properly check so that you don't get this AIDS. All right. Avoid sharing of needles. So even sharing of needles. So once used, then we must never allow to use that syringe again. Okay. So the needle must not be used again. So once, because when the needle when we go for injection, definitely the needle goes inside to your body, so it touches the blood of a person. So there, since this virus are not being able, it will not be able to seen by our naked eyes, it can be only seen through microscope. So we don't know whether the AIDS that virus is there or not. So that is why that once that needle goes touch the infected person, then, and if that needle again used to a healthy person, definitely that person will be getting disease. All right. Thank you. Have a good day. Bye bye.